Hello, I'm Dr. Scott Mills, Chief Medical Officer at Midcoast Hospital. Choosing whether or not to have your hip or knee replaced is a really big decision. At Midcoast Center for Joint Replacement, you can make that decision with confidence because our team will guide you every step of the way, from the initial consultations, preoperative planning, and preparation, to your surgery and initial recovery at Midcoast Hospital, all the way through rehabilitation and your return to daily life. We help you get back to doing what you love.
I'm Dr. Jacob Fury.
And I'm Dr. Thomas Kryzak. We are orthopedic surgeons specializing in hip and knee replacements.
In this video, we'll take a closer look at joint replacements performed at the Midcoast Center for Joint Replacement.
Hip and knee replacements are elective procedures, so you should decide if you want it done, when you want it done, where you want it done, and who you want to do it. You should plan the surgery and recovery around your life, including family issues, job issues, financial issues, or any other health concerns that you have.
Once you decide to have your hip or knee replaced, you will undergo a preoperative evaluation to minimize your risk and maximize your potential for a successful outcome.
Prior to surgery, we will coordinate your medical clearance, educate you about the joint replacement process, and answer any questions you have prior to your upcoming surgery.
You will have your blood drawn to check some basic labs. An EKG will be performed, and if you have diabetes, your blood sugar will also be checked.
You will also be evaluated by your primary care provider to ensure you are in optimal health for surgery. If you are regularly seen by any other specialists, such as a cardiologist for a heart condition, you may also need to see him or her prior to surgery.
You will also need to have clearance from your dentist. Although it sounds unrelated, it's a good idea to have any dental work taken care of prior to your procedure. Dental procedures performed after a joint replacement surgery can introduce bacteria into your bloodstream from your mouth, putting you at increased risk for a joint infection.
You do not need to have any formal physical therapy done prior to your surgery. However, it is a good idea to remain active and keep your legs strong and flexible. Post-operative rehabilitation is much easier for patients with good strength and flexibility. 1 week before your surgery, you will be given a special cleanser to use. For the 5 days leading up to the surgery, you should wash with the cleanser.
Let's meet the team that will help you on the day of your operation.
Hello, my name is Bonnie Novak and I am the manager of the registration department at Midcoast Hospital. On the day of your surgery, you will arrive at Midcoast Hospital and check in at Central Registration, located on the first floor of the hospital's main campus. Just through the main entrance, you will arrive 2 hours and 15 minutes before your scheduled surgery. While you're at registration, we will verify your information such as mailing address, phone number, emergency contact, insurance information, and get you checked in for your surgery. We will familiarize anyone accompanying you during your stay to the waiting area and cafe location and answer any questions that you may have regarding billing.
Hi, I'm Carrie LePage. I'm the Director of Surgical Services here at Midcoast Hospital. We'll place an IV in one of your arms, which will be used to administer anesthesia during surgery. Our team will also review your medical history, medications, and allergies before surgery. We will place a stocking and squeezing boot on your non-operative leg to prevent blood clots and swelling. Your surgeon will meet with you before surgery to see if you have any questions. He will confirm your procedure and mark your operative leg. Your loved one can wait with you until it's time for you to go to the operating room. Once you head to the OR, the person waiting with you will be escorted to the waiting room. Your surgeon will speak with them as soon as the surgery is finished.
At this point, we will be ready for you in the operating room. You will receive anesthesia first.
Hi, my name is Byron Hathcock. I'm the Chief of Anesthesia at Midcoast Hospital. Before your joint replacement surgery, we will discuss the different types of anesthesia that are available. You will have a chance to ask questions, and we will pick the anesthesia that is best for you. General anesthesia means that you will go to sleep and will have a breathing tube. Spinal anesthesia is an injection in your lower back that will numb you from your waist down. If you receive a spinal anesthetic rather than a general anesthetic for your surgery, you will be sedated, so you will not remember the surgery or have any awareness at any time. The sedation for spinal anesthesia is less than a general anesthetic sedation. Therefore, you will wake up sooner after a spinal anesthetic. However, your legs may still be numb for an hour or more after surgery. For knee replacements, you will also receive nerve blocks to help with post-operative pain. These will typically be done in the pre-op area before going back to the operating room. This will happen by an injection into your leg at 2 different places to help with pain relief. This will not affect your ability to walk, and you will have full motor function and be able to walk later in the day and start your rehab.
Your joint replacement will take an hour and a half of surgical time, about 2 hours if you include anesthesia and positioning time. After surgery, you will wake up in the operating room and be transported to the recovery room. You will have a bandage over your hip or knee, and you will have stockings on your legs to help prevent blood clots and swelling.
When you get to the recovery room, we'll be monitoring your vital signs. Because of the anesthesia, the nerve block, and the local anesthetic, you should have minimal pain in the recovery room. An x-ray of your knee joint will be taken. Once you are awake and comfortable, visitors may come and see you in the recovery room. Then you'll be transferred to your own private room in the medical surgical unit on the second floor.
I'm Shauna Ferry, and I'm a medical surgical nurse here at Midcoast Hospital. We are specially trained to care for orthopedic joint replacement patients. When you arrive, we'll go over your medications and your treatment plan with you. You'll receive antibiotics through your IV after surgery. We'll also start you on an anticoagulant the day after surgery. For most patients, this is a baby aspirin. Patients with a higher risk of a blood clot or those already on a blood thinner may take a different medication. You will have ice for your hip or a cryocuff wrap for your knee that will help to reduce pain and swelling. As soon as your legs recover from anesthesia, you will be able to get up to the bathroom or use a commode after your surgery. This will be slow and unsteady, and you will use a walker or crutches at first, but it will get easier each time you get up.
Once you're up and moving, it's time to start inpatient physical therapy.
Hi, my name is Jill Manuel, and I'm one of the inpatient physical therapists here at Midcoast Hospital. Your inpatient therapy is an important part of your recovery process. This will usually start on the day of your surgery if you have recovered from your anesthesia. Our goal is for you to be up and mobile with your walker the day of your surgery. You will be able to put full weight on your operative leg the afternoon of your surgery. You will also be getting up with the nursing staff that evening. For our total knee replacements, physical therapy will be focusing on lower extremity exercises, including bending and straightening your knee. Our aim is for you to have 90 degrees of flexion prior to leaving the hospital. For our hip replacements, we will be focusing on maintaining your hip precautions during your mobility. Our goal for both our total hip and total knee replacements is that you will be independent getting in and out of the bed, up and down from a chair, walking in the hallway with your walker, as well as going up and down stairs prior to leaving the hospital.
Hi, my name is Jennifer Doyle. I'm an occupational therapist here at Midcoast Hospital. Occupational therapy begins the day after your surgery. Together, we'll focus on safety and self-care activities. These include bathing, dressing, and using the bathroom. We will also learn how to use adaptive equipment to make going home from the hospital easier. Remember, every patient is different, so discharge plans may be changed to suit your needs.
Most patients will go directly home from the hospital, but we do offer integrated continuing care. Whether you're at home or in a continuing care setting, your rehabilitation will begin right away.
While knee replacement patients will have no limitations, hip replacement patients will have temporary precautions to avoid putting the hip in unsafe positions. 7 to 10 days after surgery, you may remove your dressing and leave the wound open to air. There are no stitches or staples to remove. On average, most patients following a left hip or knee replacement will be driving by about the 2-week mark. Those patients following a right hip or knee replacement usually resume driving at about the 3-week mark. You should never drive while taking opiate pain medication.
Before you leave the hospital, your outpatient physical therapy will already be arranged.
Hi, my name is Joshua Garneau. I'm a physical therapist at Midcoast Orthopedic Therapy Center. Physical therapy is a very important part of rehabilitation after a total joint replacement. You'll be attending physical therapy 2 to 3 times a week for 6 to 8 weeks. Physical therapy appointments are usually about 45 minutes long. The first 3 weeks after surgery are critically important for success. It is important to push yourself not only in therapy, but also at home. Discomfort in your new joint is normal, but it's important to push through the discomfort within the first few weeks. For hip replacements, restoring hip motion and strength to help achieve a normal walking gait is the focus. The main goals after a knee replacement are achieve full extension with the knee perfectly straight, flex your knee past 120 degrees, walk without any assistive devices, and go up and down stairs step over step. Depending on your progress and balance, you probably will not need an assistive device after 2 to 3 weeks. Remember that you are the most important part of your therapy team. If you participate in physical therapy and keep up with your home program, you'll be very pleased with your outcome.
3 weeks after surgery, you will have a follow-up appointment with your surgeon. We will make sure your wound is healing properly, review your x-rays, and discuss your rehabilitation progress. At this point, most patients are no longer using a walker, cane, or crutches, and most are almost or completely off any prescription pain medication.
Your next follow-up with your surgeon will typically be around the 3-month post-op mark. At this point, the vast majority of patients have returned to full activities. Your third and final follow-up visit will be 1 year after your surgery. During this appointment, we will take new x-rays of your hip or knee replacement. After this appointment, feel free to call the office or come in with any questions or concerns you may have.
Hello, I'm Lois Skillings, President and CEO of Midcoast Hospital. Thank you for your interest in having your surgery at the Midcoast Center for Joint Replacement. As a recent knee replacement surgery patient myself, I had the privilege of having Dr. Fury and Dr. Kryzak and the entire Midcoast Center for Joint Replacement team help me to get back on my road to recovery. Thanks to their help and expert skills, I'm already back to work and well on my way to returning to all the things that I love. Midcoast Hospital's world-class team looks forward to helping you get back to your daily routines faster with better outcomes and results, all without leaving Midcoast, Maine.